I thought I'd just start off by giving you a little bit of background about my role. So I started off in Wandsworth about 5 years ago with the then PCT as the Wandsworth locality manager. So that involved going out and about working with practices, particularly around how they could improve quality and help them to meet their targets as well. It also involved a lot of going out and about, meeting patient groups, understanding what the needs were in that particular area, and trying to really bring them forward and make sure that they were acknowledged in the grand scheme of all the work that was going on in the PCT. Subsequent to that, I moved on and did a bit of work around outpatients and making sure that people get a really good experience of their outpatient appointment in Wandsworth, or hopefully, as the case may be. And then more recently, I've become part of this primary care development team. The primary care development team is something new in Wandsworth, actually, and it's specifically been set up to try and actually make sense of and implement the changes that I really know you've heard a bit about, things like co-commissioning, the primary care transformation agenda in London, and the 5-year forward view, and all those different bits and pieces that are talking about primary care and how it needs to change, really starting to bring that into Wandsworth and work out how we can make some changes locally that will make sense to us and for our population. So, for today, because transforming primary care is quite a big area, I thought I'd start off with just giving you a bit of an overview of what we've done so far in Wandsworth, and talking a little bit about the challenges that we know still exist, and then move on to talk about some of these influencing factors like the co-commissioning, and I'll try and leave plenty of time for questions. So, this is a quote from the King's Fund, who are a sort of academic non-for-profit organisation, and they're talking very much about how important primary care is in the grand scheme of keeping patients out of hospital and everything else that GPs, doctors and optometrists do. And I think that's really important because actually, whilst I think patients and the public have a really good understanding of why primary care is important, I think actually the government and potentially NHS staff as well are only starting to wake up to that now. And actually that's probably reflected in the fact that although around 90% of contacts with the health service happen in primary care, only 9% of the health budget is actually spent on primary care, so clearly there's a huge challenge there. Now in Wandsworth, we've made transforming primary care a key part of our out-of-hospital strategy over the next 5 years, so that's a real commitment for us in terms of saying we want to move some of that investment that we're planning to make efficiencies in the secondary care and community care environment into primary care so that we can treat patients better there and hopefully keep them safer at home for longer. So as I said, a little bit on what we've done so far. So we have a number of, and I should actually just start by mentioning that CCGs don't actually have responsibility for commissioning for general practice contracts. What we do have responsibility for is this slightly woolly duty around ensuring quality in general practice, and it's no further defined than that, so it really has been left to us to kind of interpret that as we will. And we'll talk a bit more about co-commissioning later, which means that we actually are going to start to have some more influence over the core contract material. But as I said, things that we have done in Wandsworth CCG so far, we have a number of enhanced services. So these are things that we pay general practices to do over and above their core services. So we have a thing called Planning All Care Together, which I don't know whether any of you have had a PACT consultation, it might be referred to, but essentially this allows GPs to spend more time with their most vulnerable patients. So essentially there's a group of patients who they've identified as at risk of a hospital admission, and essentially you will get to spend an hour with your GP to talk about all of your health problems holistically, rather than just having a 10-minute slot to say, well, this is my one issue that I get to talk about at this time. We also have an access enhanced contract, so that's basically getting GPs to extend their opening hours in the evenings and at weekends rather than just sort of during the 9 till 5, so trying to help out the working population as well. And then we also have a series of diagnostic contracts with practices, so some of you will probably know that actually within your own practice you can have access to blood tests or a spirometry test if you might have COPD, that sort of thing. But the thing about these is they're all optional for GP practices to take up. So we actually know there's actually some inequality across the borough and practices that do deliver these things and practices that don't. So obviously that's one of the key things we really want to try and address. As I mentioned, we have this responsibility around delivering quality in general practice, so we have a number of schemes related to that. Our Members Development Programme programme is set up to enable practice teams to have some protected time to really look internally about what their key issues are, be it their front of house staff need some training, or it might be their prescribing practice isn't quite up to scratch. But they can really choose 3 areas that they then focus on throughout the course of the year to really deliver some improvements internally. And we have a practice support team, which is also made up of GPs, practice managers, who, those practices that are struggling, they can go in and actually give them some advice and guidance about how they might improve in those areas. We have a number of incentive schemes, so I'm sure I've talked to some of you before about our referral management programme. So unlike referral management centres, which you might have heard about across the country, which essentially are an interim between the GP referring and then the referral goes into this referral management centre and gets triaged, Wandsworth didn't want to go with that approach. So in fact what we did was we set up a programme of education and support for GPs so that we can actually help them to make better referral decisions with you guys in the room with them, rather than trying to put in an interim measure that would somehow take that decision away from the GP MG. We have a similar thing for pathology as well, so these are things like blood tests. So again, trying to educate GPs to make better decisions about those tests, because obviously every single one that they request has a cost attached. So we want to make sure that they're only requesting tests that are really essential. We have a programme of primary care workforce and development, which all of our practices really actively take up on actually. There's both mandatory training that they have to take part in, but also more development type work as well. So they can, for example, upskill their practice nurses to be specialists in diabetes if they want to. And it's really all based around a training needs analysis that we carry out each year, or we get practices to do an audit of what they think the gaps are, and then we can put on training to address those needs. These CRG schemes, so CRGs are clinical reference groups, and they're essentially set up within the CCG, and they're a multidisciplinary team that meets, made up of a secondary care clinician, a primary care clinician, a practice nurse, usually a managing lead as well, and they're to focus on key areas that are priorities for us within the CCG. So we know in Wandsworth that diabetes is a huge problem, so we have a CRG for diabetes. And they obviously come up with a number of schemes that are related to primary care. So, for example, we also have a COPD, CRG, which is chronic obstructive pulmonary disease. And last year they did a case-finding exercise. So all the practices took part in essentially a bit of an audit exercise to look at what patients might be at risk within the borough and get them to have a test. Because actually, if you can identify that earlier on, it saves loads of money further down the line. And obviously, it's just better for patient care as well to have that managed properly. And then we have our locality teams. As I mentioned, I was Wandsworth locality manager. We also have our West Wandsworth locality team and our Battersea locality team as well. And they have patient groups set up, which hopefully you all know about, that you can feed into. And they have their own local developed schemes as well, which address needs within those communities. So, for example, in Wandsworth, they specifically got something set up around Citizens Advice Bureau, because they knew that that was a gap, because they have a Citizens Advice Bureau in West Wandsworth and they have one in Battersea, but they didn't in Wandsworth, so they've actually set that up now. So it's just things that can address needs in the local population. So, as you can see, we're doing quite a lot of things, considering that actually we don't have responsibility at the moment for general practice services. But we do know that there are huge challenges that we're yet to even begin to address. I'm sure Marilyn touched on them earlier. So we know that practices are increasingly financially stretched, subject to rising patient demand, required to manage more complex and high-risk patients effectively. So our out-of-hospital strategy is actually trying to keep patients away from the acute environment, which is much better for patients, but actually puts more pressure on general practices. So we have to make sure that actually the funding that we're saving in the acute environment gets transferred across. We know that practices are increasingly targeted as well, and that there's an inequality in the range of services provided. So this is, I was talking about those diagnostic contracts and the access contracts, and we know that not all practices have the capacity to actually take up on those, which, although they're a small practice, they may not want to deliver all those things, but it actually means that that group of patients is potentially missing out. And they may not know those, but they potentially are. And we know that there's probably a variation in the quality of the services provided as well, although it's really actually difficult to define what that is because general practice there's so many different variable factors. And as I said, underpinning this all, we have this very woolly duty to ensure quality, so that's what we've got to bear in mind all the time. So, some of the external influences. Some of you might have had a read of the 5-year forward view. If you haven't, there's a very nice summary document that actually is really, really helpful and really does get to the point of it. And in this, there's a lot around general practice actually, and it talks about different models of general practice and the need for general practice to change the way it currently works if it's going to be sustainable in the future. It talks about things like these super practices where actually you might be able to go there and get access to a range of secondary care services as well. So all things that we've actually made a start on in Wandsworth, but perhaps we haven't actually addressed how we make sure that all the patients in the borough have access to that. There's also this thing, Better Health for London, and the report of the London Health Commission. So they also talked a lot about general practice. And actually, helpfully, their recommendations lined up quite well with the ones in the 5-year forward view. But they talked a lot around the need to improve general practice estates and the need to improve workforce as well. And those are some of the things that, as a CCG, we really don't have the resources at the moment to do. So that's something that we're looking at really as part of the South West London wider picture to try and tackle some of those difficulties. We did have better services better value, which is now the South West London Collaborative, and obviously you've heard quite a lot about that already, so I won't go back to it again. And then we've got really local influences as well that we're going to have to look at. So this is the Battersea Power Station, and obviously over the next 15 years we're expecting an influx of around 38,000 new people to the borough, and obviously that's going to have a huge impact on health services and particularly primary care actually, because we think a lot of these people are going to be quite young and fit, and actually their main touch point with the health service will be in general practice. So that's really something we need to be addressing in the next 5 years so that we're prepared for when it all happens. And then we've got these 4 gentlemen as well, and obviously the general election hanging over us. I won't say too much about that, but I'm sure there will be changes afoot once that's completed later this year. Other bits and pieces that are happening. So, there's a London Primary Care Transformation Programme. Some of you might remember the London Call to Action, which came out a couple of years ago. So this Primary Care Transformation Programme is basically an output of that. And they've been doing basically a long, drawn-out period of consultation with patients and public across London to really try and identify what their priorities are for improving general practice. And they've come up with these 17 specifications, which are around accessible care, so making sure that patients can access general practice how they need. Coordinated care, so making sure that patients, well, certainly the most vulnerable patients, have a coordinated care plan and that all the services around them are joined up. And proactive care as well, so actually that preventative bit around helping patients that are at risk stay well in the first place so they can stay healthy at home for longer. And practices are going to be expected to meet these in the next 5 years. They're going to be built into core contracts during the next during the subsequent contract reviews. And so really as a CCG, it's part of our duty as practices are our members to really support them in making sure they can meet those standards and in terms of ensuring quality as well. We really need to be working towards those areas. And then we've got this co-commissioning bit. So essentially, co-commissioning is about NHS England coming to CCGs and saying, we would like you to take on more responsibility for commissioning primary care. And specifically at the moment, this is about general practice. So it doesn't include, at the moment, dentists or optometrists or any of the specialised commissioning which goes on. It's specifically around general practice. And the guidance around this came out around last April time. And CCGs were offered the opportunity, or encouraged, actively encouraged, I would say, probably what happened, to submit an expression of interest into doing this. And Wandsworth duly did. And since then, essentially, we've been conducting a number of different consultation exercises with our member practices, with the public as well, basically to to look at what might this mean for us, where are the benefits, and actually, how can we make this do what we need to help improve services in Wandsworth. And actually, back in January, our board agreed that we are going to go for a joint model of co-commissioning from April 2015. So now this is going to be, essentially means the setting up of a joint committee, which will involve all of the CCGs in South West London and NHS England as well. So essentially there were several options. You could go for full delegated responsibility for co-commissioning, and you could take on responsibility for all of general practice. In Wandsworth, we felt that that was a bit of a risk in the first year, in which we didn't have a good enough understanding of the resource that might come with that. So we went for the sort of second option, which is to do this joint approach for the next year, where we'll be able to get an understanding of the current situation in general practice and see really where the benefits might lie, and really get our house in order as well about saying, okay, so what structures do we need in place if we're going to do it properly. So the plan is to do this joint model for a year, with the longer term aim of then going to a delegated model from April 2016, but really spending a lot of the next year doing more consultation and really scoping out what that's going to look like in the longer term. And obviously it will involve working very closely with well-being boards and Healthwatch as well, and I believe Healthwatch have a role on that joint committee as well, and obviously as we move forward to delegation, that will very much be part of the discussions as well as to how we would continue to involve you guys. Okay, so co-commissioning. There's a few slides on what will change. Essentially, this is going to enable GPs and local people to have a greater input into co-commissioning, into commissioning across the whole patient pathway. So not just looking at the secondary care and community care, but actually allowing us to join all the services up together. So if you think about your general practice and your out-of-hours general practice, at the moment, general practice is commissioned by NHS England, yet your out-of-hours general practice is commissioned by the CCG. So we'll be able to link those things together and really make things so much easier, so much easier. However, in terms of things that won't change, patients will still access their general practice in exactly the same way. So initially, at the front end, you are unlikely to see any changes whatsoever. This is entirely a change in the way that the service is commissioned, which we really hope will enable us to lever some change in the longer term. And as you see, I'll circulate these slides afterwards, so there's a number of benefits attached to it as well. So, in summary, there are a large number of changes planned to the way that general practice is going to be commissioned in the future. And although in Wandsworth we already have a number of different initiatives in place to really try and improve quality, we know there are still some really big challenges out there that we're going to have to overcome in doing that. So basically the next step is to come up with a really robust action plan and look at the detail of how we're actually going to do that in the future, using these things like the London Primary Care Transformation Programme and co-commissioning as levers to really try and generate some improvements in